Thank you, Mahalo Mapuana. I appreciate so much your perspective and joining us today. And I hope you'll stay as well for the Q&A session. We'll be transitioning next into the moderated discussion. I pass to Nancy Ooki to help moderate the Q&A for us.
Sure. So two things. One, we always want to take questions from the audiences first, so we will definitely do that. And then two, I do have a big picture question for all of our speakers. And because it's a big question, I'm going to tell you ahead of time and give you some time to think on it. And then we'll come back around to the speakers to ask you about this question. And then there is a question in the chat that I will start with. So I'll give everyone a minute to breathe and think of a question before we start. So the big question for our speakers is going to be, what are some of the immediate actions that need to be done to promote a healthier population in Hawaii with regards to your project in your area? So again, just what are some of the immediate actions that need to be done to promote a healthier population in Hawaii? And I'll come back around to the speakers. But there was a question a while ago, and I'm pretty sure this is for Rachel. And Glenn, correct me if I was wrong on that. But the question was, is food waste an issue in the Pacific as it is in Hawaii? And is Rachel still on? I saw her a while ago. She may have left.
Rachel has a meeting.
Okay, we just missed her. I did see her before. So before we get to the big question, does anyone have a question for any of our speakers?
Sorry, Nancy, this is Christine. Earlier, I think there's a question if any of the presenter slides would be shared or would be able to share.
I'm not sure. Soti, will that be able to happen?
Yes, I will follow up with our speakers by email, and then I just pasted the our Get Local Food System forum website that we will post all the materials there. Then you can come back and check.
Okay, I see no questions right now. You can continue to put them in the chat if you have questions, or feel free to jump in. But let's go ahead and start with. Oh, we do have one. Okay, it looks like it's for all the speakers. So what are the missing metrics you do not currently have access to that you believe would benefit your research or establishing benchmarks? And no particular order, anyone can jump in, any of our speakers. These are not simple questions, I get it. Well, we can go in order of the way you spoke. So Monica.
Sure. I think that the missing benchmarks kind of also gets at your question, Nancy, as far as the produce prescriptions go. I think what we need most immediately with these kind of food as medicine programs is a greater adoption of the programs. You know, as I showed, it's been since 2017 for us to get this program up and running at just one health center. And so people are anxious to get these Medicare waivers and all sorts of things implemented, but they need to show, you know, that the impact on health outcomes, and those take a long time to get and see. So I think most immediately for produce prescription and other food as medicine programs is that we need to, you know, start seeing more funding for these programs across the state in different settings. And I think that would give us the benchmarks and the research, you know, that would really help us to justify long-term sustainability of these types of programs.
Okay, thank you. So Jinan?
I would say in terms of information that we may be missing, that would be data on the degree to which physicians refer patients to community resources here in Hawaii. I know there have been some studies done on this, and I don't think we have information on that here. So it would be nice to know in how many instances physicians are making referrals to resources that might help with obesity prevention here.
Okay, and then did you want to add anything on the other question then? Is there any other immediate actions that you see that can help promote a healthier population?
Yes, I would say that we need to gain a better understanding of the resources available in the community to bring everything together. So that's the essence of what my research entails. It's a needs assessment to better understand what resources exist to then be able to create this more coordinated system of care.
Okay, and Mapuana?
Aloha. First and foremost, mahalo to everyone who's been sending chats my way. I sincerely appreciate it.
Can I call you back in like 2 minutes?
So I just wanted to mention, so right now, in response to the metric question, the Aina Connectedness Comprehensive Health Survey was completely developed with foreign by Native Hawaiian communities. And in fact, many of our measures and metrics are starting to redefine even the way we think about access to food and redefine the way in which we think about health. And so some of the metrics we started to explore in addition to the Aina Connectedness was self-report conditions and health conditions. And this was, again, based on our interviews and focus groups and based on some of our community consultation, but also consider things like adversities of health, including land loss and historical trauma. So thinking about the intergenerational trauma and historical losses and the way in which that's related to our Aina connectedness present day, and also mental health, as well as food access and security. And so some of these metrics we are starting to further explore, but thinking about even going deeper beyond this, some of the things that we're really hopeful for is thinking about the connection to Aina and even things like GIS mapping and thinking about how by different islands, and this is something that Glenn had mentioned, thinking about Aina connectedness and the different practices that have been revitalized and the way in which that enhances Aina connectedness, but also thinking about the way in which some of these social cultural determinants of health, such as colonization, westernization, and all of these different isms play an important role in land connectedness. This was further exacerbated again during COVID-19, where we saw not just food security was an issue, but even just being able to maintain a lifestyle in Hawaii came up. And so if I had to think about some of the current metrics that we could immediately think about, I think these are some of the immediate metrics that we can start to explore. In a beautiful, immediate way, it would be nice to also see healthful water and land. And that is just an immediate action that I think we can all take to really not just help our current generations, but our future generations as well.
All right, thank you. So Monica, I'm going to circle back around to you, not because you were first last time, but because you specifically mentioned this in your slides. But I will put this out to all of the speakers again. So in what way, or do you not think that nutritional understanding and behavior are connected to or contribute to food security? I know you specifically mentioned that it had not changed during your survey, your project, but do you think that it is connected, and how?
Well, I mean, so yes, we saw some small changes in diet, but not huge leaps and bounds. And it obviously these things are just one part of the puzzle. And I think some of the additional metrics that Mapuana is sharing are all of these other stresses that are also being placed on families. And it's daunting when I share those results because it's in the backdrop of COVID. So that this entire time that our participants were coming through the program, in the backdrop, their families, were really kind of are feeling the pain of COVID. And in the Waianae community, the partners I work with are seeing that, food insecurity is actually getting worse right now, with inflation and things. So absolutely, they are connected. And I think this is that long-term, why we try to intervene so early in young children is because it is going to take a long time to see returns and changes in some of these habits. I kind of like to think about like our farm to the ECE and our farm to school efforts and these things as growing our next generation of local food consumers, right? So we have to start these initiatives soon to reap to be able to observe changes long term. And so and I guess in our third cohort, the gut microbiome was one thing that might might actually change a little bit faster than some of it might. We might see changes a little bit quicker than we might see in the diet and some of these health outcomes. And so we've included that to see, if that's if our program's changing that. So yeah.
Okay. Mofana, I see you nodding quite a bit, so I'll go ahead and ask you if you want to add on to that. But Jinan, you're welcome to speak after that if you have something you want to contribute to.
Yeah, mahalo. I think what was mentioned is that I do certainly agree. And I think also what Dr. Esquivel was starting to allude to and what Dr. Nabatni had introduced in her remarks as well, is that deeper seated determinants of health that also play an important role. And that idea that knowledge and behaviors are critically important, but also think about the deeper determinants of health on the interpersonal, organizational, community, public policy levels that can also influence the individual. And so when thinking about these bigger, deeper issues that were further exacerbated during COVID-19, I think that really demonstrates the way in which knowledge and behaviors are important, but it's also important that these knowledge and behaviors are further enhanced with environments and built environments and systems that really support the opportunity to engage in these knowledge and behaviors. We especially saw that with a lot of community mobilization that occurred with the hope of increasing access to food and in particular helpful foods, and through more opportunities to learn how to even prepare traditional foods. The work that Cherie Shelton is doing, for example, with the Keiki produce is one way in which we can demonstrate increasing that access, but also knowledge. And we saw that a lot with some of the feedback provided during Ke'olo Ka'aina. It was very interesting because it started pre-COVID, and seeing the different transitions that had occurred, even with Aina connectedness, was very telling of the way in which we can start to dream of our future with food. And so I think that's a perfect opportunity to start to rethink the way in which we engage, not just with our food, but with food as medicine with our Aina and our land.